The problem of maternal mortality
in Kano. Do you know that in Nigeria,
every minute, at least one woman dies from complications related to pregnancy or childbirth? That translates to a total of 529,000 women losing their lives in 1 year. Do you know that Kano, Nigeria's most populous state, has a high rate of maternal mortality, resulting in an ironic situation in which women lose their lives while trying to bring forth other lives? To address the maternal health challenge in Kano State, the Resource Center for Human Rights and Civic Education, a platform of active citizens campaigning for good governance, recently conducted a study on the maternal health practices in 2 local government areas of Gwale and Kumbotso. The survey aimed at providing research-based knowledge on the state of maternal health care in the areas. The survey, which sampled 100 women and 100 men selected randomly from 7 communities in the 2 local government areas, produced the following amongst other data. Age at first childbirth. 55% of the women had their first child between the ages of 16 to 20 years. 18% of the women had already had their first child before the age of 16. Antenatal clinic attendance. 82% of women respondents answered yes to the question whether they attended hospital for antenatal, while 14% answered no. Places of delivery. 52%, absolute majority amongst the women, had the most recent delivery at home. 44% had theirs in the hospital. Reason for home deliveries. 6% cited opposition by their husband or partner to having their baby in the hospital. 3% gave the reason that hospital delivery was against their cultural or religious beliefs. Based on data from the survey, the report concludes that the problem of maternal health care in Kano State is not simply a technical one of providing the required resources in greater quantity and better quality. It involves the power relations between men and women. Addressing maternal deaths, therefore, requires concerted, consistent, and persistent effort to tackle gender inequality in such areas like education, employment, and age at first childbirth, where deep inequalities have been observed. What to do? Based on the data from the survey,
the following recommendations have been made to address the problems of maternal mortality in Kano.
A strategic impact evaluation of the maternal health system in Kano State needs to be conducted to measure its results in terms of maternal health outcomes rather than in terms of the mere expenditure of resources. A comprehensive re-strategizing for the maternal health care goals of the state is required to establish a rational relationship between those goals, the methods to achieve them, and the resources to implement those methods. At the heart of any such future strategy needs to be a systematic, sustained, comprehensive, and well-funded program to eliminate gender imbalances in the distribution of social resources, especially education, literacy, employment, income, and wealth. Funding for the maternal health care program of the state government needs to be improved to match the scale of the objective need to enhance maternal health in the state and to eliminate avoidable maternal deaths. Given that the primary health centers are the nearest maternal health care facilities to the majority of women in the project communities, it is necessary to include them in the free maternal care program as a means of enhancing women's access to maternal health care. These centers need to be better funded to equip them to deliver effective maternal health care to community women.